Hello and welcome to another episode of Inside Lagos, where we spotlight the systems shaping everyday life in Lagos State, the nation's center of excellence. Today, we focus on the Lagos State Primary Healthcare Board, its mandate, its impact, and how it continues to bring quality healthcare closer to communities across Lagos State. This is Inside Lagos. I'm Adedoja Salam Adeniyi.
Ẹni tí ò dé kò yìn ẹkùn kan. Àwa ni center of excellence. Ẹni ò dé kò yìn ẹkùn kan. Àwa ni center of excellence. Mo ní pé bó o bá dé kò yìn ẹkùn kan. Àwa ni center of excellence. Àwọn òyìnbó débẹ̀ wọ́n rí tá a jẹ́ ṣe. Àwa ni center of excellence. Haúsá débẹ̀ wọ́n rí tá a jẹ́ ṣe. Àwa ni center of excellence. Àwọn Ìgbò débẹ̀ wọ́n rí tá a jẹ́ ṣe. Àwa ni center of excellence. Gbogbo Yorùbá débẹ̀ wọ́n rí tí wọ́n mú lọ. Àwa ni center of excellence. Ẹni ò dé kò yìn ẹkùn kan. Èkó ò ní bàjẹ́ lórí àwa. Àwa ni center of excellence. Ọ̀pọ̀ ò bá dé kò yìn ẹkùn.
Lagos State, Nigeria's economic powerhouse, is a place where human drive accelerates growth and every heartbeat, young or old, matters to the city's future. In a metropolis of more than 25 million people, health and well-being are not just necessities. They are the foundation of productivity, stability, and hope. Across the world, health systems are built on three pillars: primary, secondary, and tertiary care, with primary health care (PHC) at the very base, bringing services to the people. Primary healthcare centers is where it all begins, offering the first point of contact with the health system. It is intended to be accessible and affordable for every resident. It also allows early interventions, disease prevention, and care before conditions escalate into emergencies. When Governor Babajide Sanwo-Olu assumed office in 2019, he placed health care at the heart of progress, embedding it within the Themes and Themes Plus agenda, with health and environment as core pillars, setting out to transform Lagos State's primary health care system into a responsive and resilient backbone of public health. Dr. Ibrahim Akinwumi Mustafa, MNI, is the permanent secretary of the Lagos State Primary Healthcare Board. Dr. Mustafa is a distinguished consultant, orthopedic and trauma surgeon, and an accomplished health administrator with extensive experience in clinical service delivery, trauma management, and public health leadership. With 25 years in clinical service and 18 years in top management level, Dr. Mustafa provides strategic leadership in advancing primary healthcare delivery across Lagos State, ensuring equitable access, quality service, and continuous improvement in community health outcomes.
Yeah. Good afternoon.
Good afternoon, sir.
How are you?
I'm fine. This is Oregon Primary Healthcare Center with flagship services. Good afternoon, sir.
How are you? Good afternoon. Good afternoon, madam.
What is the core value, the immediate value of PHC in Lagos State under this administration?
Under this administration, PHCs have been given their utmost place. Before now, PHCs were sort of like orphan in the state. Nobody is really taking charge of their care. But as you can see, this is a renovated PHC, and we have quite a number of other PHCs across the state. As we speak, like 57 PHCs are currently under intense renovation across the state. Over 100 patients are seen here on a daily basis. If you now even have to add to that children that are brought for immunization, then you're talking of far more number of patients that are seen.
It's antenatal day. These expectant mothers said they appreciate the healthcare services provided.
Services here are very nice. They treat us well, and so far you comply with them, everything goes smoothly. And I'll just say their services are good.
The nurses are professionals. They are doing their job. They are doing well. I have not had any issues with them, and most times I come early, so I've been attended early, and I go back early. I love their services, and I've not had any complaint or any issues with them. So sure, I want to get over here.
Wallahi gaskiya alhamdulillah. Wanga na hudu na. Ina tawa. Nan na ji daɗin aikin nasu. Na nika tahowa da. Ko su tai wani waje. A gaskiya ni dai ka inda sun haɗa min sai dai su taho nan ga.
Primary healthcare centers are the first port of call for almost all ailments before referral, and this makes them crucial in preventing complications, hence the need for it to be adequately equipped and staffed.
This is a comprehensive center, which means that it's open for 24 hours. We are meant to cover it, and we're always there. The place is opened for patients to come in. So every day we come to work. Generally, we see antenatal patients as the pregnant women, and we also manage them until delivery and even after delivery. Because of the peculiarity of this place, people come regardless of what they have. So even some people that have CA, like cancer, they also present here first. So basically, this patient needs to see specialists, and we are deeming fit to refer. We have a two-way referral, which is here. So basically, just write the referral, send to the specialist for them to continue management.
We also visited the Kosi Sherry Local Council Development Area, where another flagship PHC in Lagos State is situated. Constructed by the chairman of the council, Honorable Samiat Abolanle Bada, now renamed the Senator Oluremi Tinubu PHC and rebuilt with modern equipment, this center offers high-quality services to the people of the area and the environs, enhancing healthcare access for the community.
So you are taking 5 main morning nights for 5 days.
Here at Senator Oluremi Tinubu Ikosi PHC, we see over 300 patients every day that utilizes our different healthcare services, from GOPD, doctor's consultation, family planning, immunization services, health promotion services, and pharmaceutical services, then laboratory services too. Well, on a daily basis, about 5 delivery every day. So that runs to almost 30 in a week, and that gives us about over 100 in a month. Yes, they personalize this place a lot, pregnant women, yes. Our ANC is always full.
Lagos State Primary Healthcare Board was established in 2006. The vision is unequivocal: to develop a sustainable primary healthcare system where disease burden is reduced to its barest minimum and quality of life enhanced. One of their flagship programs is the Community Health Insurance Scheme, designed to make health care more affordable for low-income families.
The drugs are well stocked, this side and this side. They also have the store where they keep other stock of of drugs that they will use in the first place. But here is where you come to collect your drugs when you have been seen by the doctor and you've paid for the drugs. There is also the other part which has to do with insurance. That is Ilera Eco. Ilera Eco also operates here. If you are enlisted on Ilera Eco, and we're seizing this opportunity to tell our people that they should get enrolled on Ilera Eco. Once you do that, you visit this facility, the doctor sees you and prescribes the drugs for you. You don't have to pay, because that would have been taken care of by your subscription to Ilera Eco, which is the basic social health insurance scheme in Lagos State.
Dr. Mustafa says, under the leadership of Governor Babajide Sanwo-Olu and the stewardship of the Lagos State Primary Healthcare Board, the state has taken bold steps to modernize its PHC network across the 57 local council areas.
So how has the Primary Health Board evolved over the years under the Babajide Sanwo-Olu administration?
Oh, that's a very big deal. Since the inception of Mr. Babajide Olushola Sanwo-Olu, as the governor of Lagos State, the primary health care sector has actually been enjoying a new lease of life. Before he came in, nobody wants to go to the primary health care center. People used the primary health care centers majorly for vaccination only. But now, as you can see here, we have antenatal, we have people coming in for routine treatment. So there is a new lease of life. People have more interest in coming to the primary healthcare sector. Now, beyond that, just to give you a snippet into what the governor has been doing, right now, what used to be the permanent site of the Lagos State Primary Health Care Board, that was just pockets of cubicles, is now a 6-level high-rise building that will be completed in the next four months. This is something unprecedented anywhere in the country at the headquarters of the Primary Health Care Board or Primary Health Care Agency, as it were. So beyond that, most of our primary health care centers that people would not even want to go to because of what they look like, they are now wearing new look. If you take a look around the metropolis around Lagos State, go from Ikeja to Badagry to Ikorodu, Lagos and Ekpe, all our primary health care centers are now wearing new look. They are being renovated massively. Right now, the state coastal, unlike what we have in many places, is under solar power. So and then given to this coastal is where we keep the vaccine that is given all over the state.
And that's our next port of call.
Yes.
All roads lead to the Lagos State Cold Store. The Lagos State Cold Store is a crucial facility where all vaccines are kept at optimal temperatures to maintain their potency, ensuring the state's primary healthcare centers and vaccination programs have access to effective vaccines.
It is a waste store, meaning you have vaccines and diluents there, what you mix the vaccine with. We have the dry store inside where you keep the needles and syringes and then your papers and data tools and everything. We can have a look. The vaccines, they are meant to maintain what we call the cold chain. It comes from the country of manufacture. So the injection ends on the arm of a child. It has to maintain a particular temperature, which is cold. And that means you cannot have failure at any time. And here we have all the three sources of power connected to the grid, but we are connected to the Lagos State Independent Power Project, IPP. And then we have 3 generators here, a 100 kVA and a 200 kVA. In addition to that, we are also solar powered. The whole of Lagos State, including private facilities, all depend on here for their vaccine needs. So we would need for this to at least be 3 floors. This particular building should be at least 3 floors. And then we should have more cold rooms, working cold rooms, that will accommodate more of our vaccines to take care of the teeming population. And we are looking forward to that time that will be done. We're hoping that this year or thereabout, we should begin to have that done. The state governor is very interested in that, no doubt. As part of the rejuvenation of the primary health care facilities across the state, this will also be one of them.
Giving vaccines is a crucial part of the Lagos State Primary Health Care Board's activities, which include routine immunization, vaccination campaigns, and targeted interventions to prevent diseases like measles, polio, cervical cancer, and hepatitis. The state government has recorded a major milestone in the health sector with the introduction of the measles and rubella vaccines into the routine immunization program across the state.
So that's the presentation of gift to the child who has just been immunized.
Under the purposeful leadership of Mr. Governor, Mr. Babajide Olushola Sanwo-Olu, healthcare in Lagos State is firmly recognized as a right, not a privilege. Guided by the Teams Plus agenda, this administration has made strategic investment in primary health care, maternal and child health, and preventive health care as the foundation of resilience and inclusive health system. Across our health district and local government, we have witnessed the rehabilitation and expansion of primary health care centers, development of modern medical equipment, digital health system, renewable energy solutions, and continuous training and motivation of frontline health workers.
Measles, which we all know as Ebola or Tita as it were, is a very severe illness, and it can lead to blindness in children. That is, in children that were never vaccinated. Those of us here that were vaccinated, we never suffered this. Unlike measles, rubella is a milder form. Rubella will often present mildly, but it becomes bad when it affects a pregnant woman. And this disease is so contagious that if any pregnant woman should get in contact with a child that already has rubella, that pregnant woman is highly likely to have the child inside her infected. And when this child is infected, this will lead to what we call congenital rubella syndrome.
We want to implore our adolescent girls aged 9 years that you should please continue to ensure that they get these vaccines. They're not just medicines, but they are essential shields. And thank God we're congratulating Lagos State for being one of the pioneer people to put in measles and rubella together.
Lagos State, under the leadership of His Excellency Mr. Babajide Olushola Sanwo-Olu, is investing heavily in the health infrastructure and is also investing in the immunization of our children. You know that these children, they are the future of Lagos, and so a healthy citizen is a healthy state. So by doing this, you know, it enables our young ones to grow and reach their full potential.
The measles and rubella vaccine marks a significant step toward protecting children from vaccine-preventable illnesses.
We are starting this immunization exercise across the length and breadth of Lagos State.
The board is not stopping there. It rolled out a campaign across the state engaging in road shows and sensitization on the importance of measles and rubella vaccines.
I want to tell our people to know that this vaccine is free. Nobody will take any kobo from you. It is free, it's effective, and it is also safe. Yes, for some of our mothers that have been giving their children vaccine, they want to tell you that sometimes children get irritable after vaccination. Sometimes they have little fever. Sometimes just little. All of these things are what we call adverse event following immunization, AEF. But these are mild stuff that many times when you give paracetamol, that's the end of it. Sometimes you just need to tepispongium, and that's the end of it. So people should not be swayed from ensuring that their children get vaccinated now during this campaign and after this campaign to continue with the routine immunization.
We didn't just start today. We've been having these plans for the past 6 months. We've looked at what our population is. We've looked at how much vaccines we will need to properly vaccinate everyone. We've figured out how do we even get to where these people are staying. All these plans have been put in place. We didn't just do that because you can't take vaccines and just badge onto people. We've had conversations with heads of agencies, all our sister ministries within the government, We sat down with community leaders, we sat down with traditional leaders, religious leaders, educational sector, just to ensure that the information is out there to everybody.
We need to create a lot of noise because it was measles before, now we have 2. So if we want to take our children to the health centers, we need to let them know they are taking 2 vaccines rolled into 1. So it's very important that we create as much as sensitization for our people to be able to know that it protects them against 2 diseases.
When a child is ill, that comes with fever, vomiting, headaches, and all this could get worse and can actually even lead to death if not well managed. And one of the challenges with diseases like this is that they may not be easily diagnosed because the people may think it is malaria and you start to treat something that is not, and there's no way of telling how each child responds to a particular illness. And it wasn't about viral illnesses, that when you have them, they lower immunity, then other illnesses too can also come into play. So that's why it's best to prevent it. Because once you prevent it, then you are covered against, when these viruses are all over the place, and that child will be protected.
In today's health landscape, data is power. As such, Lagos State is harnessing technology with digitization initiatives to track patient records and improve continuity of care. Through digital health records and monitoring systems, PHCs are becoming smarter and more adaptive, enabling better decision-making and public health responsiveness. The state government is not relenting on the challenges facing primary healthcare delivery in Lagos today.
We are groaning under the heavy weight of the Japa syndrome, as you may be aware. But as you're also aware, the Lagos State government is doing a lot in that area to mitigate the effect of the Japa, but still, we have some gaps to fill. We just recruited about 670 staff in the last 1 or 2 months, courtesy the approval of the state governor. And this cuts across all the cadres, including doctors, nurses, pharmacists, lab, environmental scientists, and community health officers. But then we're still short of about 2,500 staff.
The Primary Healthcare Board is the backbone of Lagos healthcare system, overseeing more than 300 health facilities across the state. For the first time in the state's history, under the Babajide Sanwo-Olu administration, practicing medical professionals were elevated and appointed as permanent secretaries to lead 6 new primary healthcare administrative districts. This move aims to ensure experts' oversight and a coordinated response. While government action alone is not enough, collaboration with local and global partners has bolstered advocacy for maternal, newborn, child and adolescent health services across PHC facilities. The impact of this intervention is real. Now, mothers are finding care closer to home. Children are immunized on schedule and families no longer travel hours for minor ailments.
First point of call,
when things happen.
And we're doing a lot of work in that respect now to encourage people to see the primary health care facilities as being good enough for them and not leave it for the very low in the society. Right now you have the middle class. You the middle class are already visiting our primary health care centers for care.
This edition of Inside Lagos has highlighted the work of the Lagos State Primary Healthcare Board in taking quality health care to the grassroots, knowing that our healthy population is the foundation of development. And that does it onto this edition of Inside Lagos. Many thanks for being a part of it. I'm Adedoja. Salam Adini.